Angle possible?
Yeah.
Video out of it?
Maximum coverage.
Are we ready?
Yes.
Okay. Here's the heart, and you can see above the heart right there, this big blue. Are we doing veins or arteries, or are we going to do both?
Both if possible.
Okay, well, we'll do veins first, and we'll do arteries.
Okay.
So here we are. This is superior vena cava, right there. The superior vena cava is formed from the confluence, from the anastomosis of two brachiocephalic veins. These are the brachiocephalic veins here. They're real short. Real short. The brachiocephalic veins are formed from the anastomosis of the external jugular vein and the subclavian vein. The subclavian vein in the armpit is actually called the axillary vein.
It's the same one though, it just continues?
Same vein, same thing. And in the arm itself, it would be the brachial vein.
Okay.
Same vein, just different names because of different places. What you don't have here is I guess this is the internal jugular. It did not fill up with very much latex.
Okay.
But so in most cats it looks bigger than this, and on an exam I'll find a bigger one.
What is this bottom one then? We thought this was external and internal.
I don't know what this is. I don't know what that is. This is external right there.
Okay.
I don't know what that thing is.
So the internal branches off much sooner than...
Well, actually, anastomosis.
Okay.
So they come together. They don't branch off.
Okay.
Okay, this blood vessel right here, this is the subscapular vein. Subclavian vein, subscapular vein, axillary vein, brachial vein in the arm.
Okay.
Okay? And there's one more vein that we learn here in the upper part. This vein that enters the superior vena cava right before the superior vena cava enters the heart. That's the azygous vein. Azygous. It's singular. It's draining the elastic connective tissue of the lungs. It's draining the vertebrae. It's draining the back muscles. Okay? Okay. Arteries above the heart. This artery right here, this is the pulmonary trunk artery. There. The aorta is partially covered up with connective tissue, but it would come out it's right in there, and it would come out and bend around as an arch. That's the aortic arch.
Okay.
Giving off two branches. The first branch is the brachiocephalic trunk artery. The second branch is the left subclavian artery. The brachiocephalic trunk artery has three branches of its own. The first branches, and I'm going to try to separate things out here. You can see three branches. There's one branch right there. That's the left common carotid artery. Left subclavian artery. I'm sorry. There's the left subclavian artery. I'm sorry. It's the left common carotid artery. I'm mixed up, and I'm on tape at that. It's the left common carotid artery. There's the right common carotid artery, and the third one is the right subclavian artery. So those three branches come off the brachiocephalic trunk. The brachiocephalic trunk artery is the first branch off the aortic arch. The second branch off the aortic arch is the left subclavian artery. So the right subclavian artery is a branch off the brachiocephalic trunk. The left subclavian artery is a branch off the aorta. The aorta continues around. By the way, the arteries are just like the veins. The subclavian arteries, as they pass through the armpit, we call axillary arteries, and then as they enter the arm proper, we call them brachial arteries. And where you can see this subscapular vein coming from the subscapular region and the subscapularis muscle, the artery is heading down to it, and they run parallel. There's the artery right there.
Okay.
Yeah. They're both going in that direction. Common carotid arteries, we saw them here, but up here in the neck, which is where I'll ask you, there's the left common carotid artery right there.
I couldn't even notice it. It's just like the same color.
Right, yeah, I know, it didn't fill with much latex. The right common carotid artery is right there.
Okay.
And then right between them, you have the trachea. There's the trachea, and you can see the cartilage rings there.
That's kind of cool, yeah.
And then right here, this is kind of oozed out from behind. This is the esophagus. This squishy thing, that's the esophagus that's squeezed out. It belongs down underneath and behind the trachea like that. Just kind of ooched out. Just, the dead cat effect. Okay?
Probably getting shoved in
Well,
there.
what I
every
can
night.
do is take a sharp probe and move this over and stick a pin in there and say name the tube. You got to know it's esophagus.
Okay. Esophagus.
Are we good?
Yes.
Okay. On the heart itself, you can see coronary arteries. Those are the pink ones. They don't show up real well, but the coronary veins do. Those are pretty good coronary veins there.
Would you just stick in the pin in the heart and say, what are these veins?
Name the blood vessels. Yes. Below the heart, there is right here is the inferior vena cava, and there's a lot of pericardial sac left here, but you can still see it. That's inferior vena cava right there. There's a lot of clotted blood, but that's the inferior vena cava.
Okay.
Good?
Yes.
Okay. Let's see. Let's do arteries down below first. The aorta comes out of the heart, bends around, and then you can see it heading down toward the diaphragm, just behind the lungs on the left side. It goes through the diaphragm, punches right through the diaphragm, and comes out right there. See it coming out?
Yeah.
The first branch is the celiac trunk artery. The second branch is the superior mesenteric artery. The third branch, and there are two of those, they're paired, are the renal arteries. There's one on each side, one going to each kidney. The fourth branch is singular. It's this one right here. It's the inferior mesenteric artery. And the aorta itself ends when you get down to the pelvis. It branches into two external iliac arteries. There's the one on the left, external iliac artery. Medial to that is, let me clean it a little bit, on both sides, is an internal iliac. There's the left internal iliac, there's the right internal iliac. Okay, the external iliac heads out into the leg as the femoral artery. And then it leaves the thigh area and heads down behind the knee as the popliteal artery. Right. The vein stuck to it, so I'll bring them both up. There's the popliteal artery and the vein.
Okay.
Now, before it dives down in there, it gives off a little thin branch that you can kind of see right in there. That's called the saphenous artery. And when I forgot, there's a branch, there's an artery and a vein coming off right here. The vein is here, the artery I don't see. There's the stump of the artery right there, I guess.
Okay.
I can't tell. That's the proximal caudofemoral artery and vein here. I think those are all the arteries.
Awesome.
Okay, let's do the veins. Below the heart, we already saw the inferior vena cava. There it is again, right there, underneath the heart. It heads on and receives a renal vein coming from each side. There's more inferior vena cava. And then way down here at the pelvis, it receives two common iliac veins. Right there. There's a common iliac vein on the left, and there's one just like it on the right. They anastomose right there. You can see there's the one on the right there. The two common iliacs come together to form the inferior vena cava. Now, right here, you can see there's a blue vein coming in to join right there. That's the internal iliac. This is the external iliac. The anastomosis of the external iliac and the internal iliac flow together to form the common iliac that we just looked at. Okay, back to the external iliac here. We don't do anything more with the internal iliac. The external iliac, though, is formed from the femoral artery in the leg itself. flowing right along parallel to the femoral artery. And then that's the proximal caudofemoral vein. Oh, great saphenous vein, right here. Let me see, how can I say this? This is the popliteal vein running opposite the popliteal artery. But right here, this thing coming in is the great saphenous vein. The great saphenous vein runs along with the saphenous artery, but it's bigger.
Okay.
Both on the super.
Much bigger, it looks like.
Yeah. Well, I don't know how much bigger it really is. A vein is a thinner walled thing, and so it spreads out more with the same latex pressure. So I'm not sure what the difference in size is. I think it is bigger. Okay, now I think that's it, except for the hepatic portal system. So here we go with the hepatic portal system. The landmarks for that are the arteries here. This artery right here is the celiac trunk artery, carrying blood into the stomach and the spleen. Carrying blood out of the stomach and the spleen is running parallel to that. This one right there. See the yellow one?
Yeah.
And the pink one? The pink one is the celiac trunk artery. The yellow one is the gastrosplenic vein. The gastrosplenic vein joins this yellow one here that's running parallel but opposite directions to, let me poke it here. Let me make sure I got it. There it is. Yeah, that's it. There it is. Right there. Do you see? Do you see the yellow one and the pink one there?
Yeah.
Okay. That's superior mesenteric artery and vein. The superior mesenteric vein anastomoses with the gastrosplenic vein to form the big, thick, fat, heavy hepatic portal vein right there. And all you can see is the stump of it because it dives down underneath and goes to the liver. On a test, I'll find a real good, bright yellow, robust vein to ask you.
Okay.
There's one more, and that is the inferior mesenteric vein running right along the large intestine. There's the inferior mesenteric artery. The inferior mesenteric vein is running in the opposite direction. The inferior mesenteric vein joins the superior mesenteric vein, and that joins the gastrosplenic vein to form the hepatic portal vein. So those four veins, hepatic portal, gastrosplenic, superior mesenteric, and inferior mesenteric, are the four veins that will make up one of the stations on the test, hepatic portal system. Eugenia.
Is the mesenteric vein called that because it goes right through the mesentery?
Exactly, and same with the artery. It goes right through the mesentery on the way to the intestine. Yes. That's all of them. It's really not that hard.